and a true Samaritan who never misses a chance to assist those in need. We convey our heartfelt appreciation to Milana Garu for bringing this incredible TTA community. We seize this moment to express our gratitude towards the exceptional leadership of our esteemed President Vamshi Reddy Garu and the visionary President-elect Navin Reddy Garu. We extend our special thanks to Bharat Reddy Madadi Garu, an Atlanta resident, who is our past president and current advisory council member. We extend our special thanks to AC members, EC members, BODs, standing committee members, and thank them all for their priceless contributions in various capacities round the year for TTA. Last but not least, we welcome our TTA members and guests joining the webinar from all corners of the world. Myself, Deepika Reddy Nalla, serving as social media co-chair. And now I invite our AC member Bharat Reddy Garu to speak few words about TTA.
And one thing, Deepika, I'll introduce Bharat. Bharat is our TTA past president, and he did an awesome job during the COVID time. He successfully conducted a lot of medical webinars, and aware to the community. And also is presently is an advisory member of the TTA organization. And welcome Bharat Garu for joining the webinar. Thank you. Yeah. Bharat. Bharat is mute. Bharat.
Sorry, yeah, I'm trying to unmute, but yeah.
Yep.
Good morning, all. Thank you, Deepika, and so thank you, Diwakar Garu, for taking the lead and organizing this wonderful webinar. And thank you, everyone, for joining Sunday morning. And special thanks to Dr. Nandini Sunkiredi for coordinating and hosting this webinar. And also Dr. Raghu Garu, as well as Dr. Deepika Talluri for moderating this wonderful webinar. And this very much needed webinar in the current situation, because it's very prominent in our Asian community about this, fatty liver and obesity. So it's pretty much everywhere. So this very kind and very thoughtful on your side to come up with this kind of wonderful webinar. And Dr. Nandini has been helping a lot of local Telugu as well as local Indian community in Atlanta and as well as nationwide. We really appreciate her services towards the TTA as a CME chair and also as a volunteer, as a doctor, helping a lot of community members out here. So I really appreciate and thank her for relentless volunteer service in North America. And also we are very fortunate to have Dr. Raghu DK Garu to be in the webinar to give the insight and give his being a gastro, is coming from the professional, reaching out to all the normal people and how to be, what not to be, and educating them. That's very thoughtful and very helpful. And Dr. Raghu Garu, thank you very much for taking time and helping us and everyone understand the situation currently right now. And also Dr. Deepti Talluri Garu also for moderating this event. And special thanks to Diwakar Garu, our ED, Executive Director, for coming up with this webinar, as well as Deepika Garu for coordinating. And also thank Mala Reddy Garu, who is our Advisory Council Chair, for being there and forming this TTA so that they create a platform so that we can cater to all the Telugu Telangana people across the nation. And me as Advisory Council member, I invite you all for this webinar. And thank you again for everyone for joining.
Thank you, Bharat Garu, for your valuable words. We truly appreciate them, Andi. I now kindly request Dr. Deepti Talluri Garu.
No, Vamshi Reddy. Vamshi Reddy is joining now, Andi. Deepti. Yeah.
Okay.
Yeah, hello, Andi. Thank you very much, Andi.
Sorry, Vamshi Garu. Yes, please go ahead, Andi. Thank you.
No problem. I'm sorry, I'm outside, so I couldn't turn on my video, and there's a little bit of a noise. Apologies for that. But as Bharat Bhai mentioned, right, this organization is formed by our beloved Paila Mallareddy Garu, who is our founder, and then we have our advisory chair Vijaypal Garu and co-chair Mohan Garu, and our Bharat Bhai is our advisory member. Bharat Bhai, thank you for joining. I would love to see this session, Andy, and a very, very important session, especially after pandemic. Uh, so thank you very much, Raghu Garu, Dr. Raghu Garu, Nandini Garu, for coming forward to take this session. Really appreciate it. And thank you, Deepthi Garu, for moderating it. The Atlanta team, as always, Deepthi Garu, Swati, Bharat Bhai, all of Atlanta team, thank you for bringing this up. And ever, Divakar Garu, thank you for bringing more sessions on health and wellness and helping the community. Yeah, I don't want to take much time. Thanks everyone for joining. Let's roll it.
Thank you, Vamshi. Thank you, Vamshi.
Thanks, Vamshi Garu. Appreciate your time, Andy. Now, yes, I kindly request Dr. Deepthi Taluri Garu, a healthcare administration professional with a physician background, associate for Forsyth County Drug Council Board, to introduce the esteemed speakers of today's webinar.
Hello, good morning, everyone. Thank you, Deepika, for your kind introduction. And I highly thank Tata team for organizing this informative webinar. And I welcome each and everyone who are joining this session for today. So before we kickstart this session, I would like to introduce two wonderful speakers for today. So the first one, Dr. Nandini Sunkireddy. She is an amazing board certified family practitioner here at Atlanta. She is a 5-star rated physician, and she is specially board certified in obesity and lifestyle medicine. So she's basically an obesity and lifestyle medicine specialist. So apart from this, she's having a website, Style Your Health MD. She recently started that, and she's also having a YouTube channel. So audience and each and everyone who are interested, please feel free to subscribe her YouTube channel for many such informative, educative, health related and lifestyle related issues. And coming to our next speaker, Dr. Raghu. He is also an amazing gastroenterologist. He finished his internal medicine here in USA. And later he is a board certified gastroenterologist and a hepatologist. In 2018, he moved back to India, and currently now he is working at Apollo Hospitals, Banjara Hills, Hyderabad. So people of Hyderabad or, the Telugu speaking regions, so feel free to reach to our Raghu Garu for your future consultancies and all. So thank you so much, Dr. Nandini and Raghu Garu, for Dr. Raghu and Dr. Nandini for being part of today's session. And now comes, and now Dr. Nandini will talk. She would like to present regarding obesity. Thank you so much.
Madhu, Nandini unmute చేయండి. Okay.
I'm unmuted. Thank you so much, Deepthi, for the good introduction. And this is a much needed topic, and thanks to TTA team, they've been always supportive about all these webinars. And thanks to everybody in Atlanta and Divakar Jangamgaru, who has been very supportive in doing these webinars, and he's been always encouraging us. So I want to talk about obesity in South Asians. So I'm a primary care physician, and I'm an obesity physician as well. So first of all, when it comes to obesity is a it's mainly because of a lot of reasons. It doesn't eat less, work out more, and you're going to lose weight. That doesn't apply to everybody. So, and especially when it comes to Southeast Asians, the criteria for obesity is completely different. A lot of people, they get deceived by the BMI criteria. When they go to the doctor, they see the BMI and they think that they go with the Caucasian scales and they think that, okay, well, my BMI is 25, so I'm all good. But that doesn't apply to South Asians. And that was my major point. When you look at the screen, you can see that with the South Asian criteria, anything above BMI of 23 is considered as overweight. So you got to be very careful about that. And with South Asian population, we have thin fat disease or lean. We are still obese even though our BMI is less. So one of the other criteria we use in South Asians is waist circumference. So when you measure your waist circumference around the umbilicus or below the umbilicus, what happens is, like, if for men anything more than 90 centimeters and for women anything above 80 centimeters is considered as obese. So that's when you really have to take the thing seriously and start working on those. And why is it important? Why is it important to treat obesity? Obesity is linked to around 293 diseases, and causes of obesity are multifactorial. And mainly obesity is related to nutrition, like what we eat, and exercise, physical activity, and the behavior. The mental health also plays a big role on gaining weight. And there are a lot of medications which are in the market in the United States right now, and which we widely use. And do reach out to your primary care, or do reach out to one of the obesity doctors close by. So surgery used to be one of the major stay for treating obesity, but now it's not anymore. And sleep also plays a major role. And if nothing works, then we have the bariatric surgery. So coming to each and I'm going to discuss about one after the other. So nutrition, like when it comes to diet, so eat less, work out more. That's the advice you get from the doctors. Unfortunately, that doesn't work. No single intervention works for everybody. So there are wide variety. Everybody is different. We're all individuals. So everybody's diet is different. So whenever we give, you have to take into consideration what's the patient's preference. Like some people eat meat and some people don't. And the nutritional requirement, like, I mean, what exactly the person needs. And the medical conditions, if they have diabetes or if they have hypertension, certain diets are not permitted. So you have to take everything into consideration. And the most important thing, what I tell patients is fat diets, keto diet, Jenny Craig's, Weight Watchers, you name it. There are like tons of diets now. And even like in Telugu, like the Veeramachineni diet and all those things. So I get patients all the time asking about these. I tell them, all these diets, the good news is they all work. They all help you to lose like 20 pounds, 30 pounds. But the bad news is they all fail. You are not going to do it forever, and they're not sustainable, and they're going to fail. So you have to make sure that like you think about it before you start any of those diets. So, and mainly the main thing, what we advise is Mediterranean eating pattern. Mediterranean eating pattern is pretty much similar in most of the respects to Indian diet, but mainly they eat more salads, more whole foods, and less less of all the junk food, like what we eat, like the fried food, like pakoras, samosas, and all those things, and limit high sugar beverages. I ask patients all the time, like if they eat Indian sweets. They don't eat Indian sweets, but they do drink a lot of tea with sugar, and that's enough to mess you up. And whenever you lose weight, remember there are a lot of hormones which make you gain weight. So you have to make sure that you know about it. So you have to be persistent. You have to be mindful of that. And when it comes to exercise, I get this all the time. Doc, I ate chicken biryani last night, but like I ran on the treadmill for an hour. So I burnt all those, but unfortunately that doesn't work that way. So mainly like exercise does not help you to lose weight. Like, I mean, people have this concept wrong that like whatever you eat and you burn it, and unfortunately does not work. So exercise alone helps you to lose maybe 1.6 kgs or 3.5 lbs, but exercise alone does not make you lose weight. So the CDC recommends 150 minutes of moderate intensity exercise with like 2 days of strength training. And strength training is very important. Like whenever I talk about exercise, people only think about cardio exercises, but strength training is one of the most taxing thing. And strength training exercises are the ones which will help you to gain the lean body mass. So it's very important. And NEAT, it's something called non-exercise activity thermogenesis. Don't ignore this fact of NEAT. because anything, like any activity you do during the day, walking, standing, climbing stairs, everything is proven to decrease the mortality. So it doesn't mean that like you run on the treadmill for 30 minutes, but you sit all day long. So it doesn't work. I mean, even though you're active during the day, it does count. And exercise helps to decrease that abdominal fat what we Indians have, and the visceral fat, and helps with insulin resistance and pre-diabetes and all those things. And sleep. This is one of my favorite thing. Sleep deprivation itself, like when you don't sleep enough, that itself can increase your hunger hormone levels, the ghrelin levels. And whenever you don't sleep for 7 to 8 hours, the hunger hormone goes up. And you can do this experiment yourself. The next day, you are going to crave for more carbohydrates, more sugars, and more junk food the next day. And you tend to eat 500 calories more than compared to the day when you slept better. So always sleep is one of the most important thing. And when I say sleep, both the quality of sleep and the quantity of sleep, both are important. So if you're sleeping and you're not restful the next day, and that's an indication that you got to go see the doctor for sleep deprivation. And whenever you don't sleep enough, the cortisol hormone goes up. And this cortisol makes you gain more visceral fat or abdominal fat. So I get this all the time, how to reduce my belly. I tell them, like, sleep better. So, and the other thing is your behavior. Your behavior plays a major role in weight loss or changing your diet, changing your lifestyle. So mainly we have a psychologist in the team where I work with the obesity team. The psychologist also helps us, like whenever you have your behavior is changed towards diet and towards exercise and all the stuff, like the problem with gaining weight, losing weight, that does not happen. So if you're depressed, you're going to eat. If you're sad, you're going to eat. If you're happy, you're going to eat. So those kind of things don't happen. Everything depends on like how your mindset works. So that's also very important. And the medications, I just want to point it out. I'm not going to talk too much about it, but like these are the medications which are currently available in the market for losing weight loss, and they're FDA approved, and it's all over on the internet, TikTok, Kim Kardashian tweeting about it, Elon Musk tweeting about like Wegovy, Ozempic, Saxenda, Mounjaro, Kisimia, all these things are in the market. They're FDA approved, they're tested, and most of the insurances do cover. So if you're talk to your doctor, if you really think about it, we can weigh the benefits versus risks about it, and then do it. And that's my presentation. And one of the biggest impact of obesity is fatty liver. So that's why I asked Raghu, who is a well-known gastroenterologist who has seen both the worlds, both the United States as well as India. So he's well aware of what like the Southeast Asians like go through with the fatty liver disease. So I hand it over to Raghu.
Hi, everyone. I should say good morning, I guess, for you guys. It's in the evening for me over here, 9:30 in the evening. Feels good to be talking to an American audience where I actually spent quite a bit of time. I trained in India and then trained in the US, stayed there for about 18 years, moved back to India now, work at Apollo Hospitals in Hyderabad. I was asked to talk a little bit about fatty liver, specifically in the South Asian population, obesity and fatty liver. It is an interesting topic. I'll just touch base a little bit because this has become an important problem, not just in India, throughout the world, I guess. It has become such a big problem. I guess about 20 to 30% of the patients that I see in my clinic tend to have some degree of fatty liver, several degrees of fatty liver, probably something to be spoken about at a later date, but grade 1 through grade 4 and beyond, which you begin to discuss about this dreaded thing called liver cirrhosis. So, which has been on the rise. And although in the countries like US, alcohol, hepatitis C may be one of the most common causes for this fatty liver and liver cirrhosis, countries like India are catching up very fast, and fatty liver has become almost very prevalent in India, catching up with the Western population. So these are some of the things that I'll be talking about. I'll be fast. So what is NAFLD, or non-alcoholic fatty liver disease, is what it's called. What are some of the stages? What is the burden on the Indian subcontinent? How do you diagnose it and manage it? So what is non-alcoholic fatty liver disease? It's basically defined as accumulation of fat in the liver in the absence of, as the name says, non-alcoholic, in the absence of recent or ongoing intake of significant amount of alcohol. So significant, although not many people follow this, but about 20 grams of alcohol a day seems reasonable amount. And beyond that, more frequent, although some people may differ from this because there's a new study coming up every few days. The recent study from Canada, which said that even one drink a day can lead to some deleterious effects such as strokes and cardiac dysfunction, heart disease, and sudden cardiac death, and all those things, dementia, all those risks from even one drink a day. So any amount of alcohol, you have to individualize it. That's what I would say. So NAFLD, non-alcoholic fatty liver disease, as we say, is a silent killer because it initially does not have any symptoms. So fatty liver in general is nothing but excess fat deposition in your liver. Everyone has about 2 to 5% of fat in the liver. When that percentage increases is when you call it fatty liver. Fatty liver by per se does not have any symptoms. You just diagnose it when you do a routine ultrasound of the abdomen. More so in countries like India, because you have these diagnostic centers in every street. You just go by any day, get an ultrasound of the abdomen, you see the fatty liver. But only when it gets advanced is when you see some of the symptoms that are mentioned over here: the yellowish eyes, appetite loss, dark-colored urine, pale-colored stools, jaundice, fatigue, weight loss, and all these things is what you see once it goes to an advanced stage. So there are several stages of this fatty liver. It could either be simple fatty liver. It's diagnosed incidentally on a routine health checkup when you do the ultrasound of the abdomen. There are some things such as non-alcoholic steatohepatitis. This probably is slightly more serious than the fatty liver. Steatosis means there's inflammation along with, it's not just mere deposition of fat, it also causes some inflammation in your liver, which can lead to a condition called fibrosis, which is nothing but scarring. The liver, which is a smooth organ, becomes a little more firm, as a result of which it hinders some of the functions that happen in the liver. Liver acts as a filtrant in the body. It detoxifies quite a few things that you eat or drink. All the alcohol gets detoxified. All the, the noxious substances you eat, all of them get detoxified in the liver. So when it becomes a little more scarred or it becomes firm, this process gets affected. So fatty liver leading to steatosis, eventually leading to fibrosis, and finally the stage called cirrhosis, where the liver shrinks in size, and it usually takes several years to develop this cirrhosis. So what is the burden of non-alcoholic fatty liver disease? It's globally accepted as one of the leading causes for advanced liver disease. In the Asia-Pacific region, increased incidence of NAFLD is attributed to the adoption of the Western diet and the lifestyle habits. And there are some predisposing factors in many community groups. So, the Asians usually are genetically predisposed to have genetic susceptibility to metabolic disorders, including, genetic variations related to lipid metabolism, insulin resistance, and inflammation, which increase the risk of NAFLD. Central obesity and insulin resistance also, central obesity basically means excess fat accumulation around the waist and the abdomen. This distribution of fat is associated with insulin resistance and subsequently increased risk of fatty liver disease. Dietary patterns, traditionally South Asian diets are rich in carbohydrates, unhealthy fats, and added sugars. These dietary habits, along with a sedentary lifestyle, can contribute to obesity and NAFLD. Cultural factors such as consuming deep fried foods, high intake of sugary beverages, and a preference for calorie-dense meals also increase the risk of fatty liver disease. So, being overweight and obese are the major drivers in the development of fatty liver disease and also cause the adverse clinical outcomes. So, like I said, some of the risk factors for fatty liver as listed over here: age greater than 50, a sedentary lifestyle, overweight, obesity, smoking, diabetes, insulin resistance, hypertension, hypercholesterolemia, and metabolic syndrome is something that you hear quite often. It's nothing but a conglomeration or a collection of disorders that contribute to metabolic disorder: diabetes, high blood pressure, obesity, hypothyroidism, dyslipidemia, or hypercholesterolemia are all risk factors for metabolic syndrome. Most of them do not develop any serious issues, but once you develop fatty liver disease, it is advisable to take a hold of them, make some lifestyle and dietary modifications, and manage these conditions. So what is the connection between obesity and fatty liver? The normal, like I said previously, the normal liver contains fat in everyone. When it's less than 5%, it's okay. Due to obesity, the fat content in the liver is increased, and this leads to deposition of fat in the liver, the firmness in the liver, loss of filtration function. So it can be subcategorized into non-alcoholic fatty liver and the NASH that I mentioned. So compared with the normal BMI individuals, the risk of fatty liver disease is approximately a 4.1 to 14-fold increase once your BMI is higher. So like Dr. Nandini said, the BMI, you can't use the same terms when you use the Caucasian race with the South Asians. The BMI probably should be adjusted for the Caucasian versus the South Asian race. So the metabolic syndrome, like I mentioned, is a cluster of the disorders such as abdominal obesity, hypertension, dyslipidemia, and impaired glycemia. So some of the factors causing fatty liver disease, it's a mix of several factors, such as the environmental factors, some factors in your liver, in your pancreas, leading to insulin resistance, leading to increased reabsorption and excess fatty deposits in your liver, leading to non-alcoholic fatty liver disease. These are some of the things that play a big role in excessive fat deposits or some of the etiologies for fatty liver disease. So there's another entity that you need to know called a lean or non-obese fatty liver disease. Although it's more common in obese individuals, non-obese individuals also can develop NAFLD, non-alcoholic fatty liver disease. So a lean NAFLD has been more found in the Asian subsets. Asians are more likely to have abdominal fat deposition at a lower BMI and are more prone to develop obesity-related complications due to excess visceral fat, even though you have a similar BMI to the Western population. We're genetically predisposed to this excess fat truncal obesity. So it's abdominal obesity was an independent predictor of NAFLD among the non-obese population, which predisposes the Asians to diabetes and cardiovascular risk factors despite having a low BMI. So how do you diagnose this non-alcoholic fatty liver disease? There are invasive methods such as a liver biopsy, which is much more invasive. It's a procedure. There are several non-invasive methods also, such as a basic ultrasound, which is a screening test when you go to any diagnostic center. You can get a CT scan of the abdomen, you can get a transient elastography or a fibroscan of the liver or a liver elastography, or an MR, magnetic resonance imaging, MR elastography also is one of the ways to, these are all the non-invasive ways. There are several blood tests also you can use, but not ideally the way to do it. These imaging modalities are probably the right way to do it. So like it says over here, the diagram, non-alcoholic fatty liver disease represents only the tip of the iceberg, what we see, whereas it reflects the ongoing devastating process inside the body. So this is a literature review of non-alcoholic fatty liver disease in South Asians. And it basically is an Asian paradox. The recent studies have suggested that NASH or NAFLD can also affect non-obese Asians, which we call as Asian paradox. So it's one of the reasons is South Asia is a growing epicenter for industrialization. Lifestyles have changed quite a bit. The dietary habits have changed quite a bit. So you need to remember that the prevalence of NAFLD has been going significantly in the South Asian population. So India, because of the westernization, be it diet, being lifestyle, has become an epicenter for fatty liver. You will not believe it, the number of fatty liver cases that I see in my clinic on a day-to-day basis. So this year, the tab over here shows you the prevalence of fatty liver disease in South Asia, specifically India, and the entire Indian Indian subcontinent, India, Bangladesh, Pakistan, Nepal, and Sri Lanka. These are the South Asian countries where you see the prevalence that you can see depending on different parts of the country over here. So what are the risk factors associated with development of NAFL in South Asia, like the ones I mentioned, similar to those in the Western world, with some subtle differences? Age, obesity, insulin resistance, and overall development of metabolic disease are the major risk factors. So insulin resistance, high waist circumference and BMI, and hypertension also seem to play an important role in these patients. So from an Indian perspective, NAFLD, non-alcoholic fatty liver disease, has emerged as one of the leading causes of liver cirrhosis, HCC, hepatocellular carcinoma, and liver transplant in India. Mainly, again, the similar things that I mentioned before: easy access to calorie-dense foods. You see the number of the McDonald's, the Burger Kings, the Wendy's, everyone that have cropped up in every street. Although this topic is about non-alcoholic fatty liver disease, but every street has a liquor shop. So the fatty liver disease from alcohol also, combined with this, has become a big issue in countries like India. And so the prevalence range, like you see over here, also varies from about 9% to 53%, depending on their risk factors. And childhood fatty liver also, we have been noticing quite a bit. Obesity in younger children also has been quite prevalent. So this has catapulted non-alcoholic fatty liver disease into a substantial public health problem in India, just as in other parts of the world. So India logged in about 31 million diabetics between 2019 and 21. So it tells you the burden in places like India. This one study done by Dr. Mohan showed that the national prevalence of diabetes, prediabetes, hypertension, and obesity has been on the rise, and including abdominal obesity and hypercholesterolemia has been on the rise. So how do you tackle this? This probably is my last slide. So lifestyle interventions is the most important thing. Weight loss and exercise. What is the appropriate weight loss? Is about 10% of body weight loss, and 30 to 60 minutes of moderate intensity activity. Like Dr. Nandini said, about 150 minutes of moderate intensity exercise per week is what is recommended. Running, swimming, tennis, shuttle, skipping, cycling are some of the things that we recommend to these patients. A healthy diet, calorie-restricted diet containing a balanced proportion of carbohydrates, proteins, and fats. Diet mixed with avoiding the saturated fats, cutting down on the alcohol, avoiding smoking. Some of the risk factors that you can look for and avoid those. There are several medications that have been used. We use a lot of vitamin E. Careful in the patients with diabetes. Saroglitazar, Bilypsa is the newer medication that has been used. We use quite a bit of it with excellent results that we've been noticing from this medication. However, it is important to control any condition that leads to development of fatty liver, as the cardiometabolic reasons are the most common cause of mortality in patients with fatty liver. So weight reduction, healthy and balanced diet, cutting down on smoking and alcohol, early screening, and preventive measures. So in conclusion, this probably is the slide that'll explain everything that we discussed until now. It is a developing problem in countries like India. It has been on the rise, and it has been causing quite a bit of health issues in countries like India. So something to be remembered. Tell your family members to be screened for this and find your risk factors for it. Try to change your lifestyle, and that's basically where we stand. That was my last slide. Thank you. Thank you for giving me this opportunity.
Wow, Raghu Garu, that's a vast information, Andy. Yes.
And one more thing to conclude, migration itself, migrating in the United States itself puts us under high risk for all these things, because we are more prone to eating out more often. And so our bodies are not used to it. So migration also puts us under high risk for a lot of these diseases.
Sure, definitely. The times of stress is when you start to binge on whatever it is. So like you said, Dr. Nandi, stress can change your hormonal balance, leading you to eat more, causing you to, develop these conditions regularly.
Thank you, Dr. Raghu Garu and Dr. Nandini Garu, for such an informative and important session, Andy. I definitely feel more informed, and of course, our audience feel the same. And thank you so much for posting questions. I kindly request Dr. Deepti Garu to conduct Q&A session, please.
Oh, Thank you, Dr. Nandini and Dr. Raghu, for your valuable and informative brief talk. Yes, and please post here if you have like any questions and would you like to know more about obesity and fatty liver, please feel free to post your questions here in the chat box and I'll be addressing. And let's see the questions. Yes. Okay, so I think this question is for Dr. Raghu. So this is from Reshma. So she's asking, what should we do? What should we do to reduce grade 2 fatty liver? And what risk is grade 2 fatty liver? And she's also asking if grade 2 reversible. She just wanted to know about grade 2.
So I keep telling all my patients who are worried about the stages of fatty liver. There's several stages of this fatty liver, grade 0 being normal, 1, 2, 3, and 4 eventually developing into liver cirrhosis. Grade 2 is midway. I always tell them, consider this as a warning sign. You correct things, it is reversible. You do not reverse the cause that caused the fatty liver in the first place. It's only going to progress to liver cirrhosis. Liver cirrhosis is irreversible. Grade 2 fatty liver can be reversed by reversing the cause that caused the fatty liver in the first place.
Okay. Thank you, Dr. Raghu. And let's address the second question. This is from Dinakar Shetty. I think Dr. Nandini, you're the good person to ask this. He has some question on the weight loss help. So he wanted to know whether is statin or wine safe, and is it reversible? Is the weight loss reversible?
So the weight loss is definitely reversible because we see it all the time. Like if you change your diet, exercise, and if you do all the right things, like weight loss is definitely weight loss. You lose like 5 to 10% of the weight, and whenever you lose 5 to 10% of the weight, like you see a greater change in all your numbers. Actually, what I recommend in my weight loss clinic is don't drink alcohol. So, and as minimum alcohol as possible. And statin is something which is going to be a lifesaver for you. If you want to like budge between statin and alcohol, I would say like go for the statin.
Okay. So, and Dr. Raghu, a question for you. So what diet is better for fatty liver? Is it a plant-based or a high protein meat?
Definitely a plant-based diet, like how Dr. Nandini said. A Mediterranean diet has been studied in fatty liver and then has shown the best results in losing weight. It's not just the diet, it's also the caloric intake that matters a lot. A lot of people tell themselves, I'm eating only a plant-based diet. I eat salads every day, but what about the dressing you put in it? How many calories go into it? So it's not just the diet you eat. How many calories are going inside is what matters. If you're eating a lot of saturated fats, diet rich in red meat, all these contain a lot of fat content. So again, if you're eating lean meats, whole grains, all these tend, eating a lot of legumes, pulses, and all these tend to have more natural fibers in them, and avoiding the processed foods probably is one of the important things in preventing fatty liver disease. So to answer your question, is not just purely a plant-based or meat-based diet. It's the caloric intake that matters more than anything else.
Okay.
And when you eat, I want to and when you eat plant-based diet, to be honest, a plant-based diet is less calorie dense than compared to animal-based diet. And the other thing with the plant-based diet is it's not about like, okay, well, you're putting a lot of oil and making a curry or paneer or malai kofta or things like that. It's more about whole foods. Like more salads, more greens, and more vegetables. So that's what we recommend most of the time, which is less calorie dense.
Okay. So thanks to both of you. And the other question is, what medication helps to non-alcoholic fatty liver disease?
Although there's not many or any FDA-approved medications for fatty liver disease, there have been some medications such as vitamin E and but vitamin E, you have to be careful in patients with diabetes to use vitamin E. There are some other medications such as saroglitazar, which is available in India, has been used quite a bit, has shown to reverse fatty liver disease and reverse the fibrosis also in some patients and also normalizes the liver function test to quite a bit. So I use that medication quite a bit in my practice over here in India.
Okay, thank you so much. And the other question is from Purna. I think both of you can answer this. So her question is, Hi, recently my mother, age 60 with type 2 diabetes, diagnosed for mild cirrhosis with splenomegaly and gross ascites. In hospital, they removed 6 liters of fluid from liver. Now my question is how to prevent storing fluid from liver in future, how liver can heal itself and reverse the damage.
So I'll probably answer that question. She, like you said, she has diabetes, and assuming she has not consumed alcohol, she has had non-alcoholic fatty liver disease, the topic of today, which has eventually progressed into liver cirrhosis. That's exactly what I've been beating around all this while, saying if you do not correct it, it eventually leads to liver cirrhosis, which it has in her case. Once it reaches the stage of liver cirrhosis, it's irreversible, and you have the liver basically has started the failing process. As that happens, fluid builds up in your belly because the body loses the ability to, handle excess sodium and excess water in your body. So it also has several other complications. Cirrhosis, build up of water in your belly and feet is one of them. Increased risk of liver cancer, increased risk of ammonia buildup in your body, bypassing your liver and going to the brain, leading to a condition called hepatic encephalopathy, portal hypertension, leading to a condition where you have blood vessels in your esophagus getting bigger, and then they rupture, leading to blood vomiting or black colored stool. These are several things that can happen with liver cirrhosis. So what you need to do for her, your mother, is make sure she gets screened for hepatocellular cancer or liver cancer every 3 to 6 months, get blood tests every 3 to 6 months, consult a specialist hepatologist or a liver doctor close by wherever she is, watch the salt intake because the body loses the ability to handle salt. So 1 to 2 grams of sodium every day, because your body, the sodium prevents the water from leaving your body. The more sodium you take, more salt you take, the body retains all the water in your body. So get rid of that salt from your diet, avoid the soups and all the salty foods from your diet. And also, increase your protein intake, because your albumin levels also go down in patients with liver cirrhosis, which can cause you to have that third spacing or the belly fluid buildup in your belly. So to answer your question, once it's liver cirrhosis, reversal is not possible. It is called decompensated liver cirrhosis the moment she has belly fluid. You have to monitor it, consult a liver specialist, and you need to consider a liver transplant as the final ultimate treatment for this person with liver cirrhosis, which has decompensated.
Okay, thank you, Dr. Raghu. So the next question is from Yes. So he wanted to know, does hepatitis B can also be a reason for NAFLD, and what care we should take in regards of diet?
So
hepatitis B and NAFLD diet.
NAFLD, non-alcoholic fatty liver disease, everything other than alcohol that causes fatty liver falls under the NAFLD spectrum. And yes, hepatitis B and hepatitis C are also viruses that can cause fatty liver disease. They can eventually lead to liver cirrhosis. And hepatitis B, the sad thing about hepatitis B is it is one of those viruses that can cause liver cancer even without causing liver cirrhosis. So you need to find out whether you're a candidate for treatment for the hepatitis B. If you are a candidate, early institution of treatment for hepatitis B is a must, because it can prevent viral replication, which can lead to liver cirrhosis and eventually hepatocellular cancer as a complication of liver cirrhosis. So yes, hepatitis B can cause fatty liver, and you need to consult an expert hepatologist or a gastroenterologist to get treated for the hepatitis B as soon as possible if you are a candidate.
Okay, thank you so much. And Dr. Nandini, I think, okay, yeah, someone would like to know how thyroid is related to obesity.
Definitely thyroid is related to obesity. So once you start losing weight, what happens is your thyroid number starts going up. So that's your body's mechanism to decrease the metabolism. To increase the metabolism so you don't gain weight. So when you see the numbers, we see it all the time. We diagnose as subclinical hypothyroidism, but we can give some time. Like when the patient starts losing weight, the numbers starts improving. So so weight loss is definitely one of the major thing you have to consider. And the other part of the thyroid disease is Hashimoto's thyroiditis. That's autoimmune condition, and that's a completely different condition. We see it more common in women, and especially in South Asian descent. So Hashimoto's is again like it's an autoimmune condition where it's a completely a different ball game. But like if it's related to whenever you see weight gain, like you see the TSH going up, the thyroid hormone going up.
Okay. And someone wants to know the negative effects of statins, because these days they are common, right? Everyone is prescribing statins.
So yeah, whenever we start the patient on a statin, we weigh benefits versus risk. So a lot of times, like, I get this discussion every single day, like pretty much it's like an ongoing discussion. So with our, the problem with all these numbers, all these scales they are more tailored towards Caucasian and African-American population. But unfortunately, now there's a new study coming up on masala study and all those things, which are more tailored to South Asian population. So a lot of times, like what I do in my practice is when I see an LDL going up, I also do something called check for genetic markers, ApoB, Lipo-A, and PCSK1, and all those markers. You won't believe how many people are positive for ApoB or Lipo-A. And when that is there, that's a genetic risk. They are genetically at risk for hyperlipidemia, high cholesterol. And as such, with Indian population, we are at highest risk for heart disease. So when you have that, like the statin is going to be a lifesaver. So definitely I would recommend statin in those cases.
Right.
And yeah, yes, you have to and the statin is not an excuse for not doing the lifestyle changes. You do have to do the lifestyle changes. There's no excuse for that. But along with that, the statin is going to prevent any sudden cardiac death or increased calcification in the coronary arteries and all those.
Yeah, thank you for getting that apolipo topic, because many people doesn't know about that.
Right,
so
right.
Really
I mean, every other Indian patient has ApoB positive or Lipo-A positive. So even if your LDL cholesterol is around 130, and if you have these markers positive, I would definitely recommend a statin.
Yeah, but this awareness is not in the most of our Indian community.
Right. Yeah.
Right. So people, please remember this apolipo thing. And the other question is, okay, so regarding the statins only, many people are interested to take over-the-counter fish oil, right? So do you think so fish oil is the good one?
So there are several studies which have come out now, like fish oil, you can take it. It's not going to cause any harm, but the benefits are not that great compared to the statin, to be honest. Mainly, you have to change your diet. You have to definitely change your diet and exercise and do all the things right. Sleep is one of the number one things, lifestyle intervention, but omega-3 fatty acids, taking just the omega-3 fatty acids is not proven to help you from bringing the cholesterol down.
Okay. And Dr. Raghu, so in your previous answer, you're talking about the Mediterranean diet, right? So someone wanted to know, Mediterranean diet is really high in calories. So how come they take that?
I'm not sure what part of it would be the high calorie. The meats, yes, but if you're taking the lean meats, then the lean protein, yes, not all Mediterranean diets would be high in calories. It's more of a plant-based diet with a mix of some meats. I'm not sure if a Mediterranean diet would, again, every diet, if you call it Indian diet, if you call Indian diet primarily a vegetarian diet, there are several non-vegetarian Indian diets also. So the average Mediterranean diet probably is one which is most suitable for fatty liver disease, which is a right mix of the whole grains with lean protein, is probably the reason why a Mediterranean diet has been suggested.
Okay. Right. And the Mediterranean diet, there is a My Plate method, like what we use here. The My Plate, I don't have a picture for that, but the My Plate has it has a division of how many calories you can eat based on the protein, based on fat, based on all those things. So mainly the quantity matters as well. You don't want to eat you don't want to eat too much saying that it's healthy again.
Okay, so here comes the next question. I think someone wants to know how often to do the body composition testing. I think probably it should be electrolytes and all. How often someone should do body composition testing by bioimpedance testing, and
Right.
how often do you do fibroscan?
Yeah, bioimpedance, I can answer that. So
Mhm.
I'm an obesity doctor, and we have a special scale called bioimpedance scale, where we get the visceral fat, where we get the abdominal, where we get the visceral fat, and like we get like the fat mass percentage, and we also get like muscle mass and all those things, all those parameters. So that helps us with the weight loss. So in that way, like, for example, if we are starting on weight loss medications, we want to make sure that like the person is not losing too much of muscle. So when you start losing muscle, that's not good. So, and like, I mean, it also like a lot of, we see, I mean, there's no hard and fast rule that you have to use like every 3 months. Raghu is going to answer about the fibroscan because he's an expert in that, but like there's no hard and fast rule, but that like you have to do the bioimpedance every 3 months or every 2 months or things like that. But getting an idea about where you have your muscle and where you have like your visceral fat and all those things is very important. And one more thing, what I see more common in Indian population is like we have a lot of visceral fat than compared to the actual fat mass index, and we have less muscle mass. So as the muscle, and that's why I was mentioning about the strength training exercises and increased protein in the diet, because as you increase that, your muscle mass goes up. So once your muscle mass goes up, that's going to help you decrease the visceral fat.
Okay. Thank you, Dr. Nandini.
Raghu can answer about the fibroscan.
Yes.
So the fibroscan is nothing but a non-invasive way of determining how severe the fatty liver disease is, what grade of fatty liver disease you have, or how firm or stiff the liver has become due to excess fat deposits in your liver. So there are no guidelines on how often you do the fibroscan. Fibroscan can be done as an initial test once you've been diagnosed with fatty liver to tell you how bad your liver has been damaged. And once you take the corrective action, such as weight loss, exercise, lifestyle, dietary modification, and dietary adjustments, you can repeat a fibroscan in about 3 to 6 months to see if there has been any specific change in the fibrosis or the score of your firmness of your liver. If there hasn't been any, then that's probably time to start other interventions, such as medications or certain other interventions, such as weight loss surgery or one of those things, to become more aggressive. Because in spite of dietary adjustments, if your fibrosis has not changed, then that means the risk of you developing liver cirrhosis is much higher. So that's probably the reason why you can do it at 3 to 6 month intervals, just to follow which way your fatty liver has been progressing.
Mm-hmm. Okay, thank you, Dr. Raghu. So I think this question is not just for both of you, I think for the entire Tata team. So how can the organizers and the respected doctors plan a webinar on how to pursue medical career, and what kind of medical career can someone in their 30s and 40s can pursue? Yeah, I think definitely we can do that.
Yeah,
So,
and I mean, that goes to Diwakar Garu if you can arrange that.
Yeah.
So, and one more thing, Dr. Raja Sapati, he joined as well. So I'll let Raja talk for a few minutes. He's very active in Atlanta. He's a gastroenterologist. Raja, can you open your camera and if you can unmute Raja Sapati, whoever has.
Yeah, just one moment.
I've unmuted him.
Okay.
It says, I think, Sapati's phone.
Hi, everybody. Thank you, Nandini.
Can you turn on your camera, Raja? Yeah, we can't see you, I think. Yeah.
Hi, Nandini. Hi, Raghu. Hi, everybody there. Actually, I was supposed to be out in Europe, but last-minute flight change, so I'm going today. Thank you for taking time and presenting all the details. This is very close to me. The topic is very close to my heart. I was actually, my program director was a hepatologist, so we've been dealing with fatty liver disease for a long time. Initially, we used to have hepatitis C, as the most, everybody was, all the researchers were in the hepatitis C. And now, once we have the cure, it's almost 99% curable disease now. It used to be one of the #1 indication for liver transplantation. Now, all those researchers now, due to lack of their job, now they're focused on the fatty liver disease, which has been on the back burner. fatty liver disease for regular people, what I have to say is it's like a bank balance of your money. Bank balance shana equai. So input of calories equai, lack of exercise, so you're not spending enough calories, so you retain all those calories in the form of fat, and that takes a form of fatty liver disease, giving it a chronic liver disease and chronic changes. Somebody mentioned about liver cirrhosis. That's the almost like end result of the fatty liver disease. One specific thing about Asians we are not as big or as obese as the Caucasians, but still there is something called as lean fatty liver disease, which both the speakers have gone through. Basically, just increase activity, as Nandini Garu said, increase the muscle mass. That's what we lack actually as a group, and then just be conscious of how many calories you're taking in and how much you're spending. That's all. Thank you. And any other questions, Nandini?
I think Raghu went through all the questions.
Yes.
Yeah. So any other questions?
Yes.
Deepti?
Yes. Yeah. If we are still open to answer, yeah, we have like a couple of few questions. So can you please advise if gluten and dairy cause any impact on liver?
You want me to take it or?
Raghu can take it or either one of
Well, I mean, gluten and dairy, it's again, dairy depends on what kind of dairy you take. The fat-loaded dairy, obviously, it's going to cause you to have the excess calories in your diet and lead to deposition of fat in your liver. Gluten disease is nothing but gluten intolerance is one condition where your body's ability to absorb gluten products, which are wheat, rye, oats, and barley, is lost, as a result of which it goes through you. And there are patients with gluten intolerance. We do see abnormal liver function tests as one of the telltale signs in these patients with gluten intolerance. It does cause some abnormal liver function tests when you do have gluten intolerance. So yes, it does impact your liver. And to answer your question, yes, both gluten intolerance and excess fat intake in the form of high fat containing dairy can cause fatty liver.
Okay. Thank you, Dr. Raghu. And Dr. Nandini, one of the common questions asked by many. So how fast can we lose weight? Because of this fast-paced environment, everyone wants to lose super fast.
Yeah, everyone wants to lose weight. Like, I mean,
Yeah.
I get this all the time. Like
Right.
now, like we have like all the treatments in the world. We Ozempic, Mounjaro, and all those things. Like, and in Atlanta, I'm one of the obesity doctors. So pretty much I get a lot of people around to lose weight. But losing weight fast, fast diets, this is not advisable. So, basically what I advise patients is, like, I run a multidisciplinary team. Like, I'm not the only person. Like, I have a psychologist in the team, dietitian, exercise physiologist, and everybody in the team. So mainly what we say is, like, I mean, the slower you go, the better it is. It's more about lifestyle change. So, and I tell the patients, like, one step at a time, one thing at a time. And I tell them, like, it's more of a mindset thing. Even if you slept good, like for 7 to 9 hours, that's a big lifestyle change. That's a win. So count your wins. Like, I mean, it's not going to happen in a day. And you just have to be very careful about like all these fat diets and fast diets, crash diets and stuff. So if you lose fast, you're going to gain fast.
Okay. Yeah. So, and also nowadays people are switching to Ayurveda and other medication, and someone wants to know, Live 52, it is a now over-the-counter Ayurvedic medication. So is it safe?
I'm not an Ayurvedic practitioner, so I'm not going to answer that question. And like, I mean, I leave it to the discretion of the patients. If they want to take it, they can take it at their own risk.
Okay, thank you. And Dr. Raghu, someone wants to know, how can someone prevent IBS? Most common thing nowadays.
Totally unrelated topic, but yes, IBS is not such a simple thing. We could probably talk for a full day.
Raja can answer. Maybe Raja is an expert in IBS.
Something that will take about a full day. To more than 50 to 75% of the practice in clinical practice is dealing with IBS. So I can tell you the burden of IBS to any gastroenterologist, not just me, more than 50% of the practice is IBS. So it's IBS is several types: pain predominant, diarrhea predominant, constipation predominant. But the most common type is a combination of all three of them. So depending on what you have, the treatment should be directed towards that. So you got to rule out other causes before you label someone as IBS. Once you've ruled out every other cause is when you start treating them, depending on the weapons you have and depending on the medications and the symptoms that the patient has. So preventing IBS, maintain a good lifestyle, eat a healthy diet, get a good amount of sleep, exercise on a regular basis, give mental health issues also a lot of concern. And that probably is one of them, and avoid stressful conditions. That probably is the most important way to prevent IBS, although there is no one simple answer to that.
Yeah, thank you. And even I believe anxiety and stress, they're the main common factors for IBS nowadays.
Yeah.
Okay, so someone wants to know, do we really have a cure for hepatitis B? Looks like they have fed up with this.
Yeah, hepatitis. Go ahead if you want to answer.
Yeah, is there like a permanent cure for hepatitis B?
There is medication. Actually, there are two medicines which we commonly use for hepatitis B. It's a chronic lifelong disease, and there are certain parameters you need to look in when we start somebody on these medications. We check their labs once every 3 months or 6 months to see if they have attained certain antibody response. It's a whole topic in itself, which Raghu can also agree with. There is no permanent cure. I mean, there are medications. Some of them need to take it for a lifetime. Some of them, if they're lucky, may turn around and then that can be cured. Hepatitis B, if you acquire it always depends upon if you're acquiring it as a child or as an adult. There's a better response when you're acquiring it as an adult. Sometimes body itself take care of it. More importantly, this is lifelong disease. That's what we need to keep in our mind. Get ultrasound and an MRI checked every 6 months to make sure, because hepatitis B, unlike the other conditions, is one condition where it can degenerate into hepatocellular cancer. Even though you don't have liver cirrhosis, you can still get cancer. So that's the one different thing which makes it more specific for Hep B is watch for the cancer.
Okay. Yeah, I think the last question for today. So someone wanted to know, like when someone is in the late 40s and trying to take the initial step towards health evaluation and screening. So what are the few steps to start with? Late 40s.
Yeah, first of all, they need to come for a physical. Like physical is covered by insurance 100%. And that will give them a roadmap of how their health is, and then they can start their steps towards that. I mean, they can start from there.
Okay.
Or you come to India and you have a diagnostic center at every corner of the street, and you can get a complete comprehensive health checkup every 3 to 6 months if you want to.
Yeah, I think probably they should know maybe early screening and late screening. They might wanted to know, are there like any differences or something like that?
Yeah, see, DP, always I tell to patients, healthcare delayed is always healthcare denied. So if you want to like take care of your health, I mean, I've seen this happen all the time. Like, oh, I'll do some exercise for 3 months and then go to the doctor. Those 3 months never happen. So if you have anything, just go right now. Go ahead and make an appointment. Go to the doctor, get the physical done, and don't take advantage of this. I mean, I'm glad in US, like we don't have the accessibility of like going to every lab out there to get the test. But just go and get it done. Make an appointment for physical. I mean, all the Indians over here, they have good insurances, but they barely use them. So just go ahead and take advantage of it and get that done.
Okay. So because today's webinar is related with fatty, I suggest colonoscopy, please, for the patient.
Yeah, 45.
Because of the late 40s, right?
Yeah. Raja can talk about it, and I think colonoscopy
Dipti,
at 45.
Raja want to talk something. Dipti, Raja want to talk something. Raja, go ahead.
Yeah. Please.
Sorry, like the concept we always grew up with, even when we were in India or here, is emergency medicine care. We never told of preventive care, even though Telugulo, there are like lots of proverbs. Same. This is the same concept. We don't go for the preventive medicine concept at all. As Nandini pointed out, we are as Indian court here, we all are lucky to have good insurances and good jobs. So they can go to Nandini, start there. And then at 45 years, there is a colonoscopy requirement. Just make sure you get vaccinations and all that also done. And FibroScan is very easily available. And my office actually is in Ackworth. We do FibroScans and we read FibroScans left and right. So that's the new thing. Don't forget the colonoscopy. It starts at 45, not 50 anymore. But one thing though is all these guidelines are based on studies done on Caucasians. Mana gurinchi evaru, nobody did any research, but we take those concepts and apply it to our race also. So I even did one conference about colorectal cancer screening in Indians. I haven't seen very rarely that somebody is coming in to get the colonoscopy.
Yeah, right. I think they have the concept that colon cancer does not happen in Indians. So I tell them like migration, when you are migrated to United States, that itself puts you under a high risk for all the cancers. So because you're adopting this lifestyle, you're adopting the diet over here. I mean, I know like a lot of people have their own excuses, but like we do see, right, Raja, like the people have sent like, we do see polyps and stuff, right? Yeah.
Oh yeah, definitely. Like that's my special.
You will be surprised the number of colon cancers I've been seeing in Indians over here.
Really?
Wow.
Oh
the
my
number
God.
of colon cancers I've been seeing in India is astronomical, actually.
Wow.
So do you think so it is because of the dietary changes, more of westernized food, fast food?
One of the reasons. One of the reasons. One of many reasons, I would say. But yes, a sedentary lifestyle. That obesity has been going up in Indians. Smoking is one of the risk factors. For alcohol also has been shown to be a cause for cancer in several parts of your body. So it's a combination of several other things. And yes, the westernization of the diet also has been playing a big role.
Okay. All right. I think people who are in this session should have got so many answers. And I think as they all said, prevention is better than care. So before you end up with some problem, please do screening and start it as early as possible when you're 25 or 30. Okay. So I think pretty much we are done with the Q&A session. And thank you so much for Dr. Nandini, Dr. Raghu, and Dr. Madhu. I'm sorry.
Dr. Raja.
Yeah, Dr. Raja, sorry. So for answering the questions and taking your time for being part of the session. So I'll hand over to Deepika. Deepika, please go ahead and...
Yes. Thank you so much, Dr. Raghu Garu, Dr. Nandini Garu, and Dr. Raja Sapati Garu for sharing your expertise and answering all the questions very patiently. And thank you, Dr. Deepti Garu, for moderating the session wonderfully. And thank you so much, all the participants for joining the webinar. We truly appreciate it and hope you all benefited from the session. And now I request our Women Committee Advisor, Swati Chenuri, to extend the vote of thanks.
Hello, everyone. Yeah, sorry, I was on mute. Okay, thank you, Dr. Nandini Garu, for your wonderful webinar. And Dr. Nandini, I knew her from last few years, and really, she's a very good friend of mine. And yeah, so the changing the health life patterns, all that benefited very well. And thank you to Dr. Raghu Garu. And also thank you to Raja Sapati Garu for joining the webinar and giving us some valuable inputs. And also thank you to the moderator Deepti Talluri for moderating this session very politely. Thank you so much. And thanks to our TTA team, our President Vamshi Reddy Garu for joining the webinar. And thank you to our advisory members, our Bharat Reddy Madari Garu for joining the webinar. And also thank you to our advisory Chair Vijaypal Reddy Garu, and thank you to our advisory co-chair Mohan Garu for giving us very much support to the TTA. And thank you to Divakar Garu for hosting this webinar and coordinating for the CMEs and conducting this webinar. And also thank you to our TTA Atlanta chapter for conducting this webinar. And thank you to our social media, Deepika Reddy and Madhu Garu for moderating this. Thank you so much.
And thank you, Dr. Raghu, and thank you, Dr. Nandini, Dr. Raja, for a very informative session. Dr. Raghu Garu is always helping our community. Thank you very much, Raghu Garu. Thank you, Andy. Yeah.
Thank you for having me.
Thank you. Thank you, Raja, and thank you, Raghu. Yeah, thanks.
Thank you, everyone.
Bye. Thanks, Deep.